I'm Paresh Dawda, founder and director of Prestantia Health. I'm a GP based in Canberra. We're really passionate about primary healthcare and making a positive difference to the lives of people we look after and our communities. In Australia, we're about to undergo primary care reform. Because of our passion, we're really keen that we learn from other countries, experts who've gone through this journey to help stimulate a conversation and a dialogue that will build on the wonderful work we're doing.
I'm Leanne Wells, and I'm an associate consultant with Prestantia Health. I've just facilitated the first vodcast in our series, Australian Primary Healthcare Innovation and Reform Vodcast series. We've just had a conversation, very inspiring and stimulating, with experts, clinical experts from England, the US, and Australia, going beyond diagnosing the problem that we've seen so many reports do, to having a deep and rich conversation about what implementation for impact means and involves in primary healthcare reform. Have a listen. Our topic for this first podcast is achieving high-performing health systems. How can we close the chasm between good policy intent into real service transformation? So our focus is squarely on improvement, innovation, and change implementation. And joining me today are some of the world's best minds in primary care improvement innovation from across the world. We have Dr. Kirsten Meisinger, Director of Leadership and System Transformation at the Harvard Medical School Centre for Primary Care. We have Dr. Johnny Marshall, OBE, from the UK National Association for Primary Care, and Johnny's also the past or former president of the NAPC. And Dr. Paresh Dawda, a GP leader and advisor, internationally and nationally recognised as a primary healthcare improvement expert, and the founder of Prestantia Health. We've seen yet another round of reports on our health systems around the world. There's been the Darzi report, the IPPR Commission on Health and Prosperity reports in the UK. There's been the recent 2024 Mirror Mirror Commonwealth Fund report, particularly examining the performance of the US system, but also comparing the performance of systems across Commonwealth nations. And in Australia, we've had a litany, it feels, of task force and expert advisory group reports. Across all of those reports, they paint a sobering picture, I think, about what is ailing our health systems. But on the plus side, they all seem to be singing from the same song sheet. While we all have different systems, Kirsten, Johnny, Paresh are working and operating as clinicians and GP and primary care leaders in different systems. They're all saying essentially the same things, these reports, that community and primary health care and preventative care is where we need transformation and where we need investment.
What really leaped out to me about these reports and the similarities between them are really three things. One is that the data, as something that we really need to get in order at the national, regional, and local level. Data really is our guide for equity and for quality of care. And when we don't have that, we lose out on the opportunity to really lean into what our patients and our communities really need for their health. Which leads to the second major spotlight in these reports, the commonality of looking at things at the population level. And honestly, this feels to me like it's been a change that we've been aware of since the start of computation and the ability to look at big data sets. We're now leaning into this kind of work, I think, at the health system level, but we haven't always connected primary healthcare and particularly primary care, the practice of access in all of our health systems, to that data and to that mindset of a responsibility for everybody in our neighborhood, particularly not in the United States. There are places that have used a geographic model. The public sector called the SUS in Brazil, Cuba are notable, really wonderful systems but they have to date lacked the power of data to really look across their population, although they have the infrastructure on the ground to be able to have people access primary health care as the way to coordinate care across the entire system. We've done that to a very limited extent in my country, much, much better in other countries, simply for the access. I do think one other useful point to maybe think about is that I think we're really in the middle of a third revolution in technology. If you think about the first revolution in technology was really the infectious disease burden that we used to have, right? And if you want to think about it, really all we had to do as healthcare was wash our hands, right? Once we figured that out, things got much better. The standard of living, of course, outside of the healthcare sector had a huge impact on that. The second revolution, I would say, is really an interventional revolution, and that really happened, between the 50s and the 80s. Cardiovascular, other major interventions that really allowed us to prolong lives, save lives of people who would otherwise have passed from an emerging chronic disease burden. Smoking cessation awareness, I think, is also important, but that really then is more of a healthcare-based intervention. The third one I would argue is actually using some of the data in population and the ability with AI to look at incredibly large data sets. And that's really the cancer revolution. We now have another way for us to live even longer in our incredibly now rich and hopefully across the entire world extensive lives. And I think that these are interesting phenomena. How does that relate to primary healthcare? Well, it actually underlines the need for us to increase our care coordination. And care coordination is not done retroactively. It's not best done in specialty. It's actually the job of primary care. So our long lives are underlining the increasing urgent need for us to really figure out how to coordinate our care across our population, using all of the technology and the tools that we have available, and using our incredibly well-trained, incredibly mission-driven primary care workforce.
If we are to transform and future-proof primary health care, can you briefly tell me what your treatment plan would be to get primary health care back on track? What do you see as the top three? I'm going to put that discipline on you. What are the top three game changers that you see systems need to implement to, as you said, Paresh, really bolster primary health care?
I'm going to start by a really provocative statement: stop building shiny new hospitals. Because I think, we get stuck in mental valleys and we keep doing more of the same. And we've got to create a constraint to force us to think differently, to think creatively. And I think, that constraint is stop building shiny new hospitals, because that will allow us to divert that investment into other models of care, into primary care-based models of care. That investment, I think, will yield dividends in the long run. So that's my number one. My number two is workforce. And I think particularly in Australia, workforce is a big issue. It's particularly a big issue the further we go away from our metro places. So as we go into rural and regional places, it becomes an issue. We've got a shrinking primary care general practice workforce. And I think the comments made earlier about teams, enabling teams, working as teams, is something we really need to think about, build on, and have the enablers, the regulatory enablers, the financial enablers put in place so we can work authentically in teams within primary care. I think it's a big issue in Australia, particularly. And my third is going to come back to technology, is harnessing technology and really looking at what's emerging, particularly around the artificial intelligence and generative AI field. When we're thinking about technology in healthcare, we think about tomorrow's health systems with a mindset of today's technology, but tomorrow's technology is going to be exponentially better than today's technology. And so we've got to think with a mindset of a future health system, and the technology that will be present when we get there in 2, 3, 4 years' time. And I think that technology is around all sorts of things. I think the insights we get from the data Kirsten was talking about, really important. I think that technology will provide more data, but I think will provide us with more data insights, meaningful, purposeful insights. I think diagnostic and the use of diagnostics, that technology will improve. I think the efficiency of processes, the technology will help support us with. I think moving away from that sort of care delivery model, which is often one-to-one, often in clinic, to a multimodal way of delivering care that's appropriate and fit for that person.
What does your tomorrow for primary healthcare look like? How do you reimagine primary healthcare?
If you look around the best of what's happening, UK, Australia, and the US, which has some really good stuff, as well as having some challenges, and you put that all in one place, then I think you'd have a healthcare system that recognises that primary care isn't about the primary care disciplines. It's not about general practice, pharmacy, etc. But it's a functional description that thinks about first point of contact, thinks about comprehensive support. It thinks about sort of personalization. And I think if you then start to roll that forward, you move away from thinking about disease and illness and biomedical models of support, and you start thinking about creating health. And you start thinking about how important that is. And you recognize that only 10% of our sense of well-being comes from healthcare, and the other 90% comes from almost every other factor in our life that's important to us. So I think if we're serious about the future, we've got to start looking at it in a very different way, but recognize this is often happening around us. So maybe if I look back with a letter to myself in 20 years' time, what I'll be experiencing is a much greater sense of thinking about health, playing a much larger role in how I stay well and keep fit, supported by community-led initiatives around how I sleep, move, eat, connect, that keeps me connected with the environment and the people around me. And there will be a team in the background, a real team. And I think that's important, that when we're building teams, we build them that they're really effective. And there's some really interesting work from Michael West in the UK that distinguishes a pseudo team from a real team, which we can unpack if that's helpful later. But real teams who've just got a sense of a proactive view of what's going on around me, what's going on with me, that are offering me the opportunity to continue to work to improve my health. They're helping me to remove the barriers that might sit between me and being healthier. And at the end of that, it's a sense of me feeling very much that I'm in charge of what's important to me, that I am part of the central part of that team that is ensuring I'm living the best, healthiest life possible. I think that exists now in places, maybe not within formal primary healthcare, but it exists around us. And I think the challenge is, how do we start to formalize that, set it on fire, and make it part of what the primary healthcare themes represent?
Kirsten Meisinger, Johnny Marshall, Paresh Dawda, thanks so much for your insights today, and thanks for helping us launch the Australian Primary Healthcare Innovation and Improvement Vodcast series on such a positive, progressive and inspirational tone. Thank you very much.
Thank you.